We're going to wrap up trunk and spine by looking at the application during exercise. So we look at some application during movement, but now we're going to look at how do we actually train the trunk and spine musculature, sometimes referred to as the core, even though the core is not completely the trunk and spine. But when we look at what you can do from the trunk and spine in terms of the musculature that's there, you're really moving the shoulder girdle towards the pelvic girdle or vice versa. So you're either moving it towards each other in the sagittal plane, either flexion and extension. You're moving it in the laterally in the frontal plane, either lateral flexion to the left, lateral flexion to the right, or you're counter-rotating the pelvic girdle and the shoulder girdle, so the pelvic girdle is turning to the left while the shoulder girdle is going to the right, or vice versa in the transverse plane for trunk rotation. This seems simple enough in terms of exercise development. But when we look at the true function of the trunk and spine, and as we'll get to in the next unit with gait, is that it's really a storage and a force generation mechanism for gait. And we look at the left lower extremity tied to the contralateral left upper extremity, and this line that exists between those two. And as one is absorbing stress like through pronation, the other one is generating force through supination. But you'll investigate more throughout your therapy career and fitness career and looking at how do we look at that or trace that through the body. But keep in mind that when we train the trunk and spine, it is as simple as just moving in the frontal plane, sagittal plane, or transverse plane. And we take an exercise that's quintessential to training the abdominals, which is the crunch, right? The sit-up or the crunch. And the main difference between the sit-up and the crunch is the availability of hip flexion. How much hip flexion are you allowing? But gravity's down in this situation, and what we're seeing here is joint flexion. The resistance or the movement is against gravity, so that's moving up in an upward direction. So this is a concentric contraction of the trunk flexors. So what you see is what you get. Remember, muscles are named for their concentric action. We'll flip you over and look at this situation where you're prone in a plank, and gravity again is down. If gravity had its way with you, your hips would move in this downward direction, but they're not. You are resisting gravity, so this is the movement's in the opposite direction. There is no movement because this is an isometric contraction. But the movement was going to be down into trunk extension, hip extension, and so the muscles that are resisting gravity pulling you into hip extension, trunk extension are the trunk flexors. Right, so we see what's supposed to be happening. It's not happening, and it's not happening because of some input from in this case, the trunk flexors. If gravity had its way, right, you'd move down in this position, and this is what would happen. You'd have extension at the cervical spine, extension at the hip, and extension through the kinetic chain. But if you resist that, that's all anterior chain work, muscles that are preventing this downward movement. This movement here, prevented by the anterior musculature. It doesn't matter if we flip you to the side and we look in the frontal plane, gravity is pushing you down in this position. Your body wants to go into this position here. It wants to drop the hips down to the floor. You're not doing that. There's some resistance there. Your body wants to go into lateral flexion to in this case, to the right lateral flexion. It's not happening. There's an isometric contraction, and it's occurring because of the lateral flexors isometrically on the left. So these ones that you see here highlighted. And again, to depict what would happen, this is what you see. This is what the gravity wants to do. It's not happening, right? Gravity wants to do this. You're going to get a shortening up here and a lengthening down here of these muscles of the left lateral flexors, but that's not happening because they're under isometric contraction. So again, this is what wants to happen in this position. It's not happening because of a isometric or concentric resistance to gravity here, because it's want to lengthen, but it's not doing that. So if we go through and look at some of these exercises here, we see a plank position, and you can see the anterior chain, the abdominals, and the obliques coming in to contract. You're seeing a stabilization from the glutes and a stabilization through the trunk and spine to the neck and shoulder. But again, gravity wants to pull down, and it's the anterior musculature, hip flexors, trunk flexors that are being recruited to resist that. We already looked at the lateral flexion here. You can see in this case, that's the right lateral flexors, right hip hikers, so the hip abductors here. You can see the spinal erectors here that are kind of resisting that flexion. So you're looking at things that are below that side of the axis. And although we're not in trunk and spine, or we're in trunk and spine, not in hip, you can see that if I do a bridge, that it's the posterior chain now, because if gravity had its way, this would want to come down to the floor, and it's the glutes, the hamstrings, the hip extensors, trunk extensors that are working to resist gravity in this case. This is the most misunderstood concept as exercise as simple as touching your toes. What you're seeing is hip flexion and trunk flexion, but this is a contraction of the trunk extensors, hip extensors, and hamstrings, because it's very difficult or confusing. It's not difficult, it's confusing when students see this and they see you going down touching your toes, so you're doing hip flexion, trunk flexion. It's very easy to say, oh, those are your trunk flexors that you're working, but it's not. It's an eccentric movement because you're going with gravity. What's easy to understand is if I come out of this position, you can clearly see that, oh, that's hip extension, lumbar extension, thoracic extension, and cervical extension. So this is flexion through the entire chain. This is eccentric. It's the extensors that are being stressed here in terms of eccentric tension being generated to slow you down, and it's clearly concentric contraction as you come up, returning back to standing. So we'll look at some of the muscles that are involved here. So we looked at the muscle groups in the previous few slides. Now we're going to look at the specific muscles that are involved in the execution of these tasks. So here you are doing a crunch, and again the crunch is just looking at pure trunk flexion. If he came up further, so his back left the ground, you hit your maximal limit of trunk flexion, and now all that rest of that motion is an anterior pelvic tilt. So the pelvis tilting forward, coming up, approximating the distance between the femur and the pelvis, thus hip flexion. But you can see that the rectus abdominis is online. Anything that can pull on the trunk that will pull you forward is going to be involved in this. So that's why you can see pec major, sometimes latissimus dorsi, only if the arms are above the head. You've moved the attachment above so that it can act as a flexor. You have obviously the obliques, all the abdominals, and then the rec fem and the psoas if needed to stabilize that pelvis. You can see here the hip flexion phase. This now is a full sit-up. So here's the crunch. There's the sit-up, and you can see that the pre-tension in the rec fem and the iliacus psoas was there just to stabilize, and now they are acting as prime movers. These have hit their limit. These are now working isometrically as you are. When I say these, I'm referring to the abdominal musculature, and that these hip flexors are working now concentrically to pull you up. When we look at hip flexion now, we look at now instead of the torso moving relative to the stable legs, we're looking at the legs moving relative to the stable pelvis or stable torso, and you can see that a leg raise is working similar musculature. You have rec fem, hip flexors, you have the rectus abdominis, and you could, if you wanted to, continue this up, and if you laid on your floor and brought your knee to your chest, you would go through a posterior pelvic tilt, thus getting lumbar flexion and recruiting more of the abdominals. And you can go so far as to do a reverse crunch, where now your torso, your shoulder girdle's on the ground, and your pelvic girdle's being lifted up into the air as you approximate closer, as you shorten those muscles. When you have sometimes the hip flexors or full sit-up is thought to be a stressful on the back or bad for the back, and it is bad if you have back issues. But if you don't have back issues, it's not bad at all. What happens sometimes is you can see that the psoas, since it doesn't have an attachment on the pelvis, it actually attaches to the tubercle of the femur, and then it slingshots the pelvis and goes right up to the lumbar vertebra onto the anterior bodies and transverse processes. And if there's not enough strength in the abdominals to actually get you up into that position, as you try to lift up, it's actually going to pull the spine and it's going to hyperextend it. It's going to pull it into a further lordotic curve. And if it's jamming pressure on the facet joints, and that could encroach upon the epidural space, nerve root, or exacerbate any kind of disc issue that may be there. So typically they put a contact surface there. You see some of these lumbar rolls that are there. That's really meant for you to pressurize that to encourage you to work the abdominals. But you can see here that the abdominals are contracting okay. So they're maintaining lumbar neutral as you're able to get that torso. If we look back at here, you can get that torso up. But if the abdominals aren't strong enough to pull you up, but you're still sending a go signal down here, what can happen is you get arching of the back or excessive arching of the back. That's because the psoas is pulling as hard as it can, but it's not stabilized by the lower back musculature. In the end, if your back doesn't hurt, full sit-ups are great. When we look at now a diagonal, where we look at like a performing a trunk flexion with rotation. So we're looking at a weird view, but gravity is still down, so this is working at the trunk flexor still. You can see some of that recruitment pattern that I shared with you. You have the rectus abdominis that are contracting as an active tendon/ligament for that linea alba, which is giving a strong foundation for the obliques to contract off of. So you have similar or ipsilateral internal oblique, ipsilateral transverse abdominis, contralateral external oblique. Transverse abdominis is kind of contracting both sides for stabilization, same with the rectus femoris. And then you're getting the scapular protractors on this side, like pec major and serratus anterior. And then you're even getting some of the neck musculature as you're coming up into that rotation. If we look at extension, so we're looking at bilateral extension, so we're looking at a prone position. You're seeing trunk extensors, latissimus dorsi, glute max, hamstrings, hip extensors, trunk extensors, thoracic extensors, and even shoulder flexors to stabilize this position. And then if we look at standing rotation, not under the effect of gravity, right, because gravity is straight down and we're looking in the transverse plane, everybody's going to come online for this rotation, both the anterior musculature, the lateral, and posterior musculature. So this is really keeping track of your trunk rotators, both from the anterior abdominal perspective and the posterior transverse spinalis and erector spinae group. So if I'm doing, in both of these cases, this is right trunk rotation, so full through the hip all the way up to the pelvis, up to the head, cervical. You're looking at glute max acting as an external rotator because you're turning the pelvis out. This foot's posted on the ground. You're getting ipsilateral erector spinae, so they're doing the same side, so the right erector spinae are pulling you to the right, and you're getting contralateral transverse spinalis musculature, so you're getting opposite rotation. So the left side multifidus and transverse spinalis group and semispinalis are turning the body to the right, whereas the erector spinae, iliocostalis, and maybe spinalis are turning the body to the right. You're getting same side latissimus dorsi. You're getting, for right trunk rotation, you're getting ipsilateral transverse abdominis and internal oblique, and you're getting contralateral external oblique. This is a good study tool if you can run through this to make sure that you keep track of, because it's very easy who's a lateral flexor, who's a flexor, and who's a extensor, especially if you have the gravity thing listed. But where it starts to get a little dicey and more confusing is when you are looking at feet stable on the ground and the shoulder girdle is moving relative to the pelvic girdle, who's acting as an agonist and who's acting as an antagonist. So use that as a study aspect. Go through those muscles, make sure you're able to identify who's operating both in trunk flexion, trunk extension, trunk lateral flexion, and trunk rotation, particularly at the cervical, thoracic, lumbar, and shoulder and pelvic girdles.